pelvis and your center of gravity shifts. And so one of the things, I was working with a client down here a few years ago, and I said, hey, do you ever notice that you grip the floor with your toes? And he said, no, I don't do that. And I said, okay, no worries. Next time I saw him, he said, you know, I actually do that. I couldn't believe it, but you were right. I do grip the ground with my toes. The reason that happens is because if your center of gravity is forward, you grab the floor with your toes to prevent you from falling forward. You see that? It's kind of interesting. So again, I'm not saying that by breathing we're going to decrease all back pain. But what I'm saying is that there's a relationship here, and it's something that needs to be looked at. And some of the top physical therapists in the world focus on this as a balancing out these two forces. Because if you don't balance out these two forces, you get to what's called a lower cross syndrome. So your abdominal muscles shut down, your low back is always tight, your hips are always tight, and your butt doesn't work. We're at increased risk for this right now because the position where we spend all of our day is in this exact position. So our hips are on, our butt's off, our abs are off, and our back's on. So this is a position that we are constantly having to combat. And this is what happens over time when we combat it. We get pressure of gravity pulling down on us, and so our spine, not only are we causing increased pull through the mechanical factors, but you have gravity that's constantly pushing down on you. So over time, as people age, they start having an increase in their upper back curve too, because if you change this curve, you're going to change the other curves. They're all connected. I have a hip issue right now, but I have to change how my pelvis is tilted to maintain my space for my hip joint. So my low back is actually straighter than this curve right here now, and it actually affects my cervical spine too, because they're intimately connected. If you change one of these guys, you change the other guy. So you round this back over time, and as we age, gravity pushes you, and so now 10%, I believe 8% of your weight is in your head. You have to hold your head up, and you're using all these guys to hold it up. And then that's how you start, so you use these all the time, and so that's what gets used to working. And so then you start using them to pull your ribs up, and so you have faulty breathing patterns that way. So it's a really kind of crazy system, and the human body is a tensegrity system. It's a tensegrity model, which means that if you pull on one of these strings, you've just changed the entire structure. And so when we look at exercise and things like that, we want to kind of select programs that are working to combat these nature of things. And it kind of looks generally something like this. We want to mostly focus on strengthening your butt, your back muscles, the front of your shins, your core, and then grip, which is something that is one of the best things for all-cause mortality. And then just stretch out the things that are normally going to be prone to getting tight, and working on different ways to make sure that you're not spending too much time in those positions. The other thing I just want to mention here too, because we're talking about movement and breath and things like that, is that this is a study that just got published in the American Medical Association that shows that how fast you can walk obviously has a direct link with your median years of survival. So the faster you can walk at any given rate, the longer you're going to live. So it makes kind of sense, but the three biggest factors to your longevity in terms of strength are your leg strength, your core strength, and your grip strength. But let's go back to breath for a second, and let's tie it in with exercise. And one of my mentors, Paul Check, would always talk about working out versus working in. And I believe there needs to be a dynamic balance between the two. Working out can be equated to spending energy or draining the body. You're on your bike in the gym, and it says we're burning 1,000 calories. That's spending that energy to do that work, right? where we could come in here and we can spend energy, but we feel better after we're doing it. Sure, on a mechanical or a physics standpoint, we're still spending energy to do it, but yet you feel invigorated after, or balanced, I guess. I don't want to say invigorated because we can feel invigorated with exercise, or any form of exercise, but we feel balanced energetically when we do yoga, tai chi, breathing, things like that. And so I really want to hit home the point of, is there a balance in how